Welcome to our 2026 Mesobook official review, where we are discussing the unique challenges and the growing hope for those diagnosed with peritoneal mesothelioma. Unlike the more common pleural version that affects the lungs, peritoneal mesothelioma develops in the lining of the abdomen and requires a specialized approach for both medical treatment and legal recovery. In 2026, we have seen significant improvements in survival rates due to advanced surgical techniques and targeted therapies that were not available just a decade ago. If you or a loved one are facing this diagnosis, the first thing you need to know is that the prognosis for peritoneal patients is often more positive than for other forms of the disease. According to the latest 2026 statistics, the one-year survival rate for peritoneal mesothelioma is now approximately 92%, and the 5-year survival rate has reached 65% for those who are eligible for aggressive treatment. The most effective treatment currently available is a combination of site-reductive surgery and heated intraperitoneal chemotherapy known as HIPEC. This procedure involves physically removing visible tumors from the abdominal cavity, followed by a high dose of heated chemotherapy circulated directly inside the abdomen to kill any remaining microscopic cancer cells. Patients who undergo this surgery see a median survival time of approximately 53 months, which is over 4 years, and many live significantly longer. However, the success of these treatments depends heavily on early diagnosis and the specific cell type of the cancer. Epithelioid cells, which are the most common in peritoneal cases, tend to respond much better to HIPEC than sarcomatoid or biphasic cells. Because these advanced surgeries are physically demanding and expensive, it is vital to secure the financial resources necessary to access centers of excellence where these specialists work. This brings us to the critical topic of legal compensation options available. In 2026, many people with peritoneal mesothelioma were exposed to asbestos through contaminated talcum powder products or through industrial work, and they are entitled to significant financial recovery. The legal landscape this year remains very favorable for victims, with billions of dollars still available in asbestos trust funds and a strong track record of successful jury verdicts. Let us break down the primary sources of compensation, starting with mesothelioma settlements. In 2026, the average settlement for a mesothelioma case ranges between $1 million and $1.4 million. These settlements are typically reached before a trial begins and provide a faster way for families to receive funds for medical bills and lost wages and travel expenses to see top surgeons. For those who choose to take their case to a jury, the potential for compensation is even higher, with 2026 trial verdicts often ranging from $5 million to over $11 million. Another major source of funding comes from asbestos bankruptcy trust funds, which currently hold over $30 billion in assets. These trusts were established by companies that manufactured asbestos products and were forced to set aside money to pay future victims. The advantage of a trust fund claim is that it does not require a lawsuit, and the payout process is much faster, often delivering funds to a family within 90 days of filing. Many peritoneal patients qualify for claims against multiple trusts depending on their work history and the products they were exposed to, which can add up to several $100,000 in additional compensation. For veterans of the US military who developed peritoneal mesothelioma due to service-related asbestos exposure, there are also specific benefits available. In 2026, a veteran with a 100% disability rating for mesothelioma can receive over $4,000 per month in tax-free disability compensation, along with access to low-cost or free treatment at the hospitals. It is also important to consider the role of talc litigation in 2026, as many women and men have developed peritoneal mesothelioma after using asbestos-contaminated baby powder for decades. Several major settlements totaling billions of dollars have been reached recently to compensate the victims and their families. To maximize your compensation, your legal team will meet to gather detailed evidence, including medical reports and pathology slides and a comprehensive history of any products used for job sites where you worked. In 2026, the process of filing a claim has become more streamlined, but the statutes of limitations still apply, which means you must act within a certain time frame from the date of your diagnosis. We recommend speaking with a specialized peritoneal mesothelioma attorney who understands the nuances of this specific diagnosis and can help you navigate both the trust fund claims and the potential for a lawsuit. This financial support is not just about the money, it is about ensuring that you have the best possible quality of life and that your family is protected regardless of what the future holds. As treatments continue to improve in 2026, the combination of expert medical care and robust legal compensation is giving more peritoneal mesothelioma patients a real chance at long-term survival and peace of mind. Thank you for joining us for this review, and please check the resources below to find a specialist or a legal expert who can help you with your next steps. Facing a diagnosis of peritoneal mesothelioma in 2026 is a life-changing event that requires both medical resilience and a strategic approach to legal recovery. Today, we are providing an in-depth review of the survival rates and the diverse compensation options available to families right now. Peritoneal mesothelioma, which originates in the lining of the abdominal cavity, is often referred to as a rare disease, but for those affected, the impact is profound and immediate. The good news as we begin 2026 is that medical science has made incredible strides in treating this specific form of cancer. Unlike the pleural version found in the lungs, the peritoneal form often responds better to aggressive surgical intervention. Currently, the 1-year survival rate for peritoneal mesothelioma is approximately 92%, and the 5-year survival rate has reached 65% for patients who qualify for specialized care. At the center of this medical progress is a procedure known as cytoreductive surgery with HIPEC, which stands for hyperthermic intraperitoneal chemotherapy. This treatment involves the physical removal of tumor masses, followed by a heated chemotherapy wash directly inside the abdomen to neutralize microscopic cancer cells. For patients who undergo this dual treatment, the median life expectancy in 2026 is now estimated at 53 months, which is over 4 years of quality time with loved ones. Some centers of excellence are reporting that their patients reach a 5-year survival rate as high as 80% when the cancer is caught in its early stages, and the cell type is epithelioid. However, accessing these specialized treatments requires significant financial resources, as the cost of surgery and hospital stays and ongoing oncology care can quickly reach hundreds of thousands of dollars. This is where understanding your legal compensation options becomes a vital part of your medical plan. In 2026, the legal landscape for peritoneal mesothelioma victims is stronger than ever, with billions of dollars available across 3 primary sources of recovery. The first source is the asbestos bankruptcy trust funds, which currently hold over $30 billion in total assets. These funds were created by companies that manufactured asbestos products and were later forced by the courts to set aside money for victims. For a peritoneal diagnosis, the average total payout from these trust funds ranges between $300,000 and $400,000, though families exposed to multiple products can often secure $750,000 or more. The second major path to recovery is through a mesothelioma lawsuit, which can target companies that are still in business today. In 2026, the average settlement for a mesothelioma lawsuit is between $1 million and $1.4 million if a case proceeds to a jury trial and results in a verdict. The compensation is often much higher, with 2026 verdicts averaging between $5 million and $11.4 million. These funds are critical for covering medical expenses and replacing lost income and providing for the long-term needs of a surviving spouse or children. A third option, often overlooked, is the disability benefits for veterans who make up a significant portion of the mesothelioma community. In 2026, a veteran with a 100% disability rating for mesothelioma can receive monthly tax-free payments exceeding $4,000 in addition to low-cost healthcare at specialized centers. Furthermore, we are seeing a surge in 2026 related to talc litigation, where individuals who used asbestos-contaminated baby powder for decades are securing massive settlements specifically for peritoneal mesothelioma. The process of securing these funds begins with a detailed